Global food policy. Food policy is one kind of public policy that related to food system which was prioritized from the most important social problems. At the global level, the United Nations, or UN, has adopted the Sustainable Development Goals, or SDGs, since 2015 as a universal call to action to end poverty, protect the planet, and ensure that by 2030 all people enjoy peace and prosperity. SDGs are a collection of 17 interlinked global goals designed to be a blueprint to achieve a better and more sustainable future for all. Among 17 SDGs, SDG 2 reflects to the global food situation which described end hunger, achieve food security and improved nutrition and promote sustainable agriculture. It highlights the complex interlinkages between food security, nutrition, rural transformation and sustainable agriculture. According to the United Nations, there are around 690 million people who are hungry, which accounts for 10% of the world population. Undernutrition has been on the rise since 2015, after falling for decades. This majorly results from the various stresses in food systems that include climate shocks, the locust crisis and the COVID-19 pandemic. Those threats indirectly reduce the purchasing power and the capacity to produce and distribute food, which affects the most vulnerable populations and furthermore has reduced their accessibility to food. SDG 2 has 8 targets to measure progress. Target 2.1 Universal access to safe and nutritious food. Target 2.2 End all forms of malnutrition. Target 2.3 Double the productivity and incomes of small-scale food producers. Target 2.4 Sustainable food production and resilient agricultural practices. Target 2.5 Maintain the genetic diversity in food production. Target 2A Invest in rural infrastructure, agricultural research, technology and gene banks. Target 2B Prevent agricultural trade restrictions, market distortions and export subsidies. Food safety policy. Food safety policy is also one of the food policies that has been implemented throughout the world for many decades. It intends to ensure food quality and manage potential risks to consumers that can occur along the food production chain in order to promote and protect human and animal health. However, food waste from improper harvest and production are concerned in some countries, while food access is still very limited in some area. Multidisciplinary approach for food security and sustainable development are becoming the broader aspects of food policy. Key agencies involved in food policy at international level are included: the Food and Agriculture Organization, or FAO, World Health Organization, or WHO, United Nations, or UN, World Organization for Animal Health, or OIE, and World Trade Organization, or WTO. The United Nations is an organization that involved in food safety policy. It is an intergovernmental organization aiming to maintain international peace and security, develop friendly relations among nations, achieve international cooperation, and be a center for harmonizing the actions of nations. The Sustainable Development Goals, SDGs, also known as the Global Goals, were adopted by the United Nations in 2015 as a universal call to action to end poverty, protect the planet, and ensure that by 2030 all people enjoy peace and prosperity. Here is an overview framework of the agencies involved in food safety throughout the food production chain. OIE, WHO, and FAO are international organizations involved in health data collection and surveillance. FAO and WHO have a collaboration under the Codex Alimentarius Commission, also known as CAC. It is the joint FAO-WHO food standards program that established to protect consumer health and promote fair practices in food trade. WTO acting in connection with international trade agreements. As part of global trade agreements, an agreement on the application of sanitary and phytosanitary measures or SPS agreement to control agricultural products and food has been reached. To ensure food safety, all countries have measures in place to prevent the spread of pests or diseases. These sanitary and phytosanitary measures can take many forms, such as requiring products to come from a disease-free area, inspection of products, specific treatment or processing of products, setting of allowable maximum levels of pesticide residues or permitted use of only certain additives in food. Domestically produced food and local animal and plant diseases, as well as imported products, are subject to sanitary and phytosanitary measures. The measures established by each country must be accepted and comply with international standards. According to the Codex, which deals with food safety, OIE is focused on animal health while an International Plant Protection Convention, or IPPC, is focused on phytosanitary. The Codex Alimentarius is a collection of internationally recognized standards, codes of practice, guidelines, and other recommendations published by the Food and Agriculture Organization relating to food, food production, food labeling, and food safety. World Organization for Animal Health, or OIE, is the central organization for cooperation in the prevention and control of important animal epidemics. Member states must report the situation of animal disease outbreaks through the World Animal Health Information System, and OIE will then disseminate the information to member states to prepare, respond, and monitor for proper disease prevention and control. Additionally, OIE has also established the Laboratory Twinning Program. The program enables the OIE to use its network of reference laboratories and collaborating centers, referred as parent institutes, to assist candidate institutes wishing to improve their capacity and scientific expertise. The OIE Laboratory Twinning Program directly supports OIE's strategy to improve global capacity for disease prevention, detection, and control, through capacity building and networking. With the concept of One Health, three major international organizations, WHO, OIE and FAO, are working together to prevent and control health risks at the human-animal ecosystems interface. They are developing global strategies and tools to ensure a consistent, harmonized approach throughout the world, and to better coordinate human, veterinary and environmental health policies at the national and international levels. The Food and Agriculture Organization of the United Nations, or FAO, is a specialized agency of the United Nations that leads international efforts to defeat hunger and improve nutrition and food security. The FAO is composed of 197 member states. It is headquartered in Rome, Italy, and maintains regional and field offices around the world, operating in over 130 countries. It helps governments and development agencies coordinate their activities to improve and develop agriculture, forestry, fisheries, and land and water resources. It also conducts research, provides technical assistance to projects, operates educational and training programs, and collects data on agricultural output, production, and development. FAO created the International Plant Protection Convention or IPPC in 1952. This international treaty organization works to prevent the international spread of pests and plant diseases in both cultivated and wild plants. Among its functions are the maintenance of lists of plant pests, tracking of pest outbreaks, and coordination of technical assistance between member nations. Establishing of FAOLEX, a comprehensive and up-to-date legislative and policy database, one of the world's largest online repositories of national laws, regulations and policies on food, agriculture and natural resources management. The Urban Food Agenda is an FAO flagship initiative to enhance sustainable development, food security and nutrition in urban and peri-urban areas, and nearby rural spaces. It consists of a vast range of policies, programs and initiatives developed and implemented in partnership with different stakeholders, civil society, academia, UN and international agencies, city networks and relevant public and private bodies and entities. The World Health Organization, WHO, is a specialized agency of the United Nations responsible for international public health. The WHO's broad mandate includes advocating for universal healthcare, monitoring public health risks, coordinating responses to health emergencies, and promoting human health and well-being. WHO established 5 keys to safer food to ensure of safe food production. The core messages of the 5 keys to safer food are: 1. Keep clean. 2. Separate raw and cooked. 3. Cook thoroughly. 4. Keep food at safe temperatures. And 5. Use safe water and raw materials. Moreover, global network of national food safety authorities, managed jointly by FAO and WHO with the Secretariat in WHO called the International Food Safety Authorities Network, InfoSAN, was established in order to 1. Promote the rapid exchange of information during food safety-related events. 2. Share information on important food safety-related issues of global interest. 3. Promote partnerships and collaboration between countries, and between networks. And 4. Help countries strengthen their capacity to manage food safety emergencies. Food policy has been developed and prioritized from global situation. Collaboration among different agencies will implement the food policy more effectively.